My name is Dr. Simone Vigod. I am a psychiatrist and researcher at Women's College Hospital in Toronto, Ontario. The focus of my research is on mental health around the time of pregnancy. I am also a professor of psychiatry at the Temerity Faculty of Medicine, University of Toronto, and the Shirley Brown Memorial Chair in Women's Mental Health Research at Women's College. It is estimated that up to 20% of pregnant and postpartum people will experience a mental health issue around the time of pregnancy. Unfortunately, it has also been shown that only about 1 in 5 affected pregnant and postpartum people receive the treatment that they need to get better. We also know that untreated mental health issues around the time of pregnancy can have an impact on the physical and social and emotional development of the children. And so that's why treatment is of utmost importance and can really impact parents, children, and families across the lifespan. It wasn't that long ago that people believed that having a mental health issue during pregnancy wasn't possible. Over the last number of years, it's only been more recently that it has been acceptable, or that we've been able to convince funders that this is really important research that we should be doing. One of the first things that we learned in our research program was how important it is to be able to reach out to the people who aren't necessarily walking into our hospitals and into our centers. And to really have messaging when we are recruiting for research studies that is not discriminatory and is not going to cause people to feel ashamed of participating. The other thing that we know is that because treatments are so inaccessible, much of what I've been doing is trying to study and improve and refine on treatments that make the treatments more accessible and more acceptable. So as an example, we developed here at Women's College an online web-based platform that was facilitated by our trained mental health therapists, where postpartum people could log in any time or day, post when they wanted to, and receive feedback asynchronously, more like a text instead of like live video. We're trialing a non-medication treatment called transcranial direct current stimulation, which is a localized stimulation just to the area of the brain that's involved in the processes that are thought to cause depression and doesn't go anywhere else. So this is a treatment that's been around for 40 years, and we know it's very localized. And so theoretically, it's of no risk to a developing fetus during pregnancy. I really think if we can introduce a non-medication treatment for these pregnant people with more severe depressions, we will really change the way that healthcare is delivered.
Our organization is focused on revolutionizing healthcare for a healthier, more equitable world. Dr. Vigod's research embodies this mission. Dr. Vigod's work as both a clinician and scientist has helped to highlight the unaddressed needs of people before, during, and after pregnancy. And as a result of her leadership, Women's College Hospital is a national leader in perinatal mental health and women's mental health more generally.
I would like to see that we no longer have a problem with perinatal mental illness in this country. I'd like to see us in a position where we have fulsome supports and preventive supports so that we don't have these impacts that we're seeing now on pregnant and postpartum people and on their children. What is so incredible about the prize is that it places trust in the researcher to use the funds, so that it could be used to prove the concept of a very novel and innovative idea for advancing mental health around the time of pregnancy, or to invest in young trainees to build capacity in this area is incredible. So by recognizing that the research is of value, I believe that it has the potential to create a domino effect where applications for research to national agencies, other foundations will have even greater chance of being funded. And then as a collective, it just really enhances our ability to move this field forward further.